80% of heart issues can be prevented. We're talking about the things you can do now for good heart health in the future with endocrinologist Dr. Akshay Jain. Before we get started, tell me in the comments where you're watching from and let us know if it's your first time joining us. Diabetes Primetime is brought to you by Reliant Community, an amazing program available exclusively for Walmart customers with a Reliant Premier meter. Get free diabetes tips, recipes, and support sent right to your phone. Just click the link in the comments to learn more. Dr. Jain, thank you so much for being here with us.
Hi, Ainsley. Thank you so much for having me back on your show.
You're an endocrinologist and an obesity expert. Why is obesity something you chose to focus on?
When I was doing my training in endocrinology, and I had a mentor who told me to always try to go beneath the surface. So when I would see people in my practice with diabetes, he would ask me to find out what's going on there. Why is it that this person developed diabetes? Same goes for when I was seeing someone with, say, high blood pressure or cholesterol imbalances. And I realized that at the root of all of these chronic conditions is one common factor, and that common factor is obesity. So, a lot of individuals who might be having obesity may not notice the health ramifications until it actually manifests with one of these comorbidities or complications. And that's why it made me think a little bit more about what can we do in order to definitively address a lot of these complications, such as high blood sugars, high blood pressure, elevated cholesterol levels. And it boils down to all going to the root of the problem and managing obesity. So that's really what got my interest in obesity. And here we are today.
So, what are some of those complications besides diabetes that obesity can lead to?
We know that obesity increases the risk of strokes, it increases the risk of cognitive imbalance, it increases the risk of vision abnormalities, it increases the risk of heart attacks, it increases the risk of irregular heartbeat, it may also increase the risk of heart failure. People with obesity, unfortunately, have a higher predisposition to developing cancers of various parts of the body. People with obesity may also develop respiratory problems, as you already pointed out about diabetes being one of the complications. We know that when increased fat deposits in the liver, it can cause inflammation in the liver. We know that people with diabetes may also have other complications that could be related to obesity at the background. So these can include things like infertility, both in men and in women, as well as a whole slew of other issues like nerve issues and kidney problems as well.
So, when we talk about obesity, I think most people think about BMI or body mass index as the way to assess obesity. What are the challenges with using BMI?
Over the years, we have found out that BMI can lead to a lot of false positives as well as false negatives when it comes to understanding an individual's health. So, allow me to explain. BMI is basically a math calculation where you look at an individual's height and their body weight. The problem is that this is where, I often go back to when I was in fifth grade. My teacher had asked me, Akshay, what weighs more, a pound of cotton or a pound of lead? So the heart of it, a pound is pound, but what makes up that pound can be very different. So for instance, people that are extremely muscular, very healthy, they may have more muscle weight, and that contributes to their overall body weight, which will then cause their BMI, which is body mass index, to go up. So these individuals may have a high BMI, but they might be very, very healthy. Take football players, for instance. Their BMIs are very high, but they are pretty healthy. On the other hand, there might be individuals with a lower BMI, but they might have significant muscle wasting, and most of their weight could be made up of adipose tissue, which is medical jargon for fat tissue. And this fat tissue is what is unhealthy. So these individuals, even though their weight is on the lower side, they might be having increased health issues because of the fat tissue, and that does not translate into an elevated BMI. And that's where the challenge is, because we then understanding the health ramifications in these individuals, whereas we are falsely targeting people that might be very healthy but with a higher BMI.
Are there certain ethnicities that are more at risk for having BMI be an inaccurate measure?
Absolutely. So now studies are showing that when it comes to calculation of the BMI and assessment of what the fat tissue mass is, not all ethnicities or ancestries are equal. So we know, for instance, that individuals who are either of South Asian ancestry or East Asian ancestry, or those who are indigenous First Nations ancestry, these individuals may have a lower BMI with a higher predisposition to fat tissue accumulation in all the wrong places. And hence, these individuals could have all the complications of obesity, even at a BMI that may not be in the obesity range.
So, is there another measure that folks at home should be using to assess their risk of heart issues and all these other health issues that you mentioned because of their weight or size?
That is the holy grail. So we are now trying to look at other assessments so that we can weed out all these false negative and false positives. There's two new approaches that are now being evaluated. One is calculating the waist to height ratio. So using the regular old tape measure, we measure our waist circumference, and then we basically do a ratio of that with the height. And if the waist circumference is half or more of your height, then it possibly indicates that the individual might be having increased fat tissue that could be predisposed in and around the organs in our belly. So that's called visceral adiposity or visceral fat. And this is the unhealthy fat tissue. And then there is a newer calculation that has been derived called the Body Roundness Index, or BRI. I'm not a big fan of the name, but what it's trying to suggest is, again, looking at the waist circumference of an individual, looking at the height and the age of the individual, and instead of just a simple ratio, it does a little bit more arithmetic calculation. Now, this is, again, a free calculator that you can just Google and plug in your numbers, and you will be told what your BRI is. And they'll also tell you whether it's in the range where you don't need to worry about increased fat mass in and around the organs of the body, or if it is in the range where potentially you might be having increased fat mass or that visceral adiposity that could lead to health problems.
We are going to pause here and do our trivia question. Folks, if you answer this question, you'll get a collection of delicious recipes that can all be made with a rotisserie chicken. You'll get those recipes for free if you answer our trivia question, which is: melatonin is a hormone that helps our bodies A, sleep, or B, digest. What does melatonin help us do? Is it A, sleep, or B, digest? Put your best guess in the comments and you'll get those rotisserie chicken recipes delivered to your Facebook Messenger inbox for free. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. Dr. Jain, we know there's a strong connection between obesity and other heart health conditions, but what if someone with obesity doesn't have high blood pressure or high cholesterol now? Are they still at risk for heart problems in the future?
That's a really good question, and the answer definitely is yes. Now, having said this, we want to make sure that we understand what constitutes obesity. So, if we are again going by just the BMI definition, in someone that's very muscular and healthy, they may not have any of these complications in the future because they're pretty healthy. But if they have increased adipose tissue or fat tissue that's contributing to health issues, even though you may not be having blood pressure problems or cholesterol problems or any of these other comorbidities now, it's only a matter of time before these things can essentially brew and then get worse. And that's when we see manifestation of blood pressure problems and other things, those comorbidities. So I think that even though someone living with obesity may not have these comorbidities, they are certainly at a higher risk of developing this in the future. And this perhaps can be looked at as this window of opportunity when we can help stop this in the tracks and then hopefully turn it back if possible.
So, can reaching a healthier weight now reduce our risk of these potential heart problems in the future?
Absolutely. As long as the weight loss is being done in a healthy manner and it is sustained. So all of us have been on, crash diets, at least once in our lifetime. And the challenge is not losing weight, but the challenge is keeping it off. And a lot of times, if we are nutritionally starving ourselves, that may lead to a little bit of weight loss, but it also leads to muscle wasting. It may make us unhealthy in the future. So the idea is to have a balanced meal while we're working towards weight loss and making sure that we're doing it in the healthy way, making sure that we are still focusing on making our exercise levels or physical activity levels adequate enough to support good muscle growth and strength, and helping our heart health, our mental health along the way as well.
So, how much weight do we need to lose to prevent these heart issues in the future? Is it a lot of weight?
So the good news is that you don't necessarily need to lose a lot of weight to see potential benefits in your health. Studies show that even losing 5% of your body weight can jumpstart a whole slew of health benefits. So people with diabetes may see that they might require fewer medications or lesser amount of insulin. People on blood pressure medications might be able to get off a pill or two or reduce the dose of their blood pressure medications. We'll see improvement in cholesterol levels. Women with PCOS or polycystic ovarian syndrome, which is basically a condition where periods might become irregular, they might start seeing more regularity in their periods with just, again, a 5% body weight loss. So if someone weighs 200 pounds, just a 10-pound weight loss can help jumpstart this. And then as we go further along the weight loss journey, if you get to the 10% weight loss mark, there is a chance that you might be able to cut down a whole bunch of medications for many chronic conditions. In fact, studies show that if you're able to achieve up to 15% or more body weight loss, people might even go into remission as far as their type 2 diabetes is concerned. So, again, the idea is a little goes a long way. So, every little bit of weight that we can lose can potentially help improve health in the long run.
So, one thing I learned from you recently is that it's not just the amount of fat we have, but rather where that fat is located that can cause heart issues. So, tell us about that.
This is a very relatively new concept because when it comes to the fat tissue or adipose tissue, as I was talking about, the three important things that matter are location, location, and location, right? So we all need fat tissue as part of our overall health maintenance. Fat tissue is not a bad thing. Fat tissue helps us regulate our body temperature. It helps promote good insulin sensitivity or making sure that the pancreas that produces insulin is working in a proper manner as long as the fat tissue is in the right place. However, when some individuals, whether it's genetic predisposition or sometimes related to, perhaps medications that might lead to weight gain or various other factors, when they start accumulating more of the fat tissue, this fat tissue then might start finding its way into places where it shouldn't be. It goes into organs where it has no business of being. So this can be places like the liver, into the pancreas, into our muscles. And when fat tissue makes its way into these organs where it's no longer supposed to be there, that's where it attracts unwanted attention. So it sets off a lot of inflammation in the body. And this inflammation will attract the cops of the body, which are basically our white blood cells. So these white blood cells, these are the soldier cells or the cops of our body. They'll come along and they'll find all this inflammation going on in these organs, and that will then predispose to a whole bunch of um, local tissue damage that can happen. And depending on where the fat cells have accumulated, these organs can be quite compromised. So the fat tissue is not necessarily a bad thing, but it's only good if it's just beneath the skin, what we call subcutaneous fat, which is where it helps with regulating temperature and all those other benefits. If it finds its way into the belly, into the organs, that's where it becomes a problem.
So, I'm thinking about that person watching at home who's wondering, how do I know whether the amount of belly fat I have is a problem? What would you say to them?
So for these individuals, I would encourage again looking at the waist to height ratio. If the waist to height ratio is more than zero point 0.5, in other words, if your If the circumference of your waist is more than half of your height, then chances are pretty high that the belly fat could be contributing to many of these medical conditions. At the same time, I think it's important to look at the overall health perspective as well. So, if you're having medical conditions that could be complications of obesity, there is a chance that you might be having belly fat in and around these organs that could be contributing to inflammation. For instance, Ainsley, I often see patients in my practice who might be on the leaner side and they have type 2 diabetes. And they often say, why is it that I have type 2 diabetes? And when I tell them that you might be having adipose tissue or fat tissue in and around your pancreas that could be contributing to your pancreas not producing enough insulin, or you might be having fat tissue in and around your liver that makes your liver leak sugar into the blood. They're often very surprised because they have always gone by this whole number on the scale or their BMI, and they didn't realize that it is the fat tissue in these organs that is contributing to their medical conditions.
So, are there certain types of food or eating habits that are more problematic when it comes to belly fat?
Yes. So we know for a fact that highly processed foods are number one reason for contributing to increased belly fat or visceral adipose tissue. So the more processed the food, the higher that likelihood of it going directly into the belly fat region. We know that foods that are high in trans fat, they can cause this. So again, fried foods can often have a role to play. We know that high carbohydrate foods or foods with very high glycemic index, this basically just shows how what is the sweetness in each unit of the food. That's called glycemic index. So these foods can then cause increased risk of belly fat accumulation. So in other words, the more processed the food or the more carbohydrate content in it, the higher that likelihood.
So, do stress and sleep play a role in belly fat or visceral fat?
I think stress and sleep are hugely important when it comes to the belly fat. So we know for a fact now, studies show that those individuals that sleep less than 6 hours a day are very highly at risk of developing type 2 diabetes and increased accumulation of belly fat. Interestingly, people that sleep for more than 9 hours a day also have an increased risk. So the sweet spot would be somewhere in that 7 to 8 hour range or so. So we need good quantity of sleep, but just laying in the bed with our eyes closed may not necessarily mean that we are getting all the benefits of sleep, because quality of sleep is very important as well. Now, unfortunately, many individuals with obesity might be having a condition called obstructive sleep apnea. And this essentially means that when we are asleep, even though we are sleeping, oxygen to the brain is getting cut off. So it's kind of like someone choking us while we are asleep multiple times each hour. Similarly, when we are under a high level of stress, whether it's mental stress or physical stress related to illness, for instance, we know that many of the inflammation markers in the body, so these are signs that there is more inflammation going on in the body, these levels of inflammation can go up. And this will have a downstream effect, leading to more belly fat accumulation, leading to worsening blood pressure, sugars, cholesterol, the list goes on and on.
So, you've mentioned muscle mass a couple of different times. Can resistance training make a difference for reducing visceral fat?
Yes, so that's the exciting news, right? All forms of exercise can potentially help in reducing visceral fat. More importantly, it helps promote cardiovascular strength and cardiovascular health. So the idea is always having a mix of different physical activities. And more importantly, doing things that you like. Exercising should not be a chore. It should be something that you really look forward to. It could be as simple as taking your dog out for a walk. You can potentially make a simple exercise a little bit more effective. So, for instance, if you're taking your dog out for a walk, I would recommend getting ankle weights or wrist weights, and you can get them easily online off Amazon or Walmart or Sport Check, depending on wherever you're at. Um, And these are just simple weights that you tie on your ankle or your wrists. And when you walk with these, it actually helps promote good muscle strength. It helps because this is what we call a weight bearing exercise. It works against gravity, and it helps promote both your muscle strength as well as your bone strength. If you are able to do more weight training exercise, and that doesn't necessarily mean going to the gym, simple things like using a resistance band. You can get a whole bunch of resistance band for like $20, and you can do them at home no matter how good or bad the weather is outside. And doing that can also help improve your muscle mass, and it leads to resistance training. So all of these are very good exercises that are easily performed at home, and you don't need a fancy gym membership. But these can help promote your body, improving your cardiovascular health, and then hopefully burning off a little bit of the mass of adipose tissue or fat tissue that's in and around the muscles.
In case you're just joining us, we're here with Dr. Akshay Jain talking about how to prevent future heart issues, and we're giving away a collection of healthy, delicious recipes that can all be made from a rotisserie chicken if you answer our trivia question, which is: melatonin is a hormone that helps our bodies A, sleep, or B, digest. Does melatonin help us A, sleep, or B, digest? Put your best guess in the comments and you'll get those delicious recipes delivered to your Facebook Messenger inbox for free. Folks, we want to make sure you never miss an episode. Make sure to like or follow us on Facebook to see all of our updates. So we've talked a lot about the connection between obesity and other conditions like diabetes or heart issues. As an endocrinologist, is trying to reach a healthier weight something you encourage your patients to focus on?
Absolutely. I think it is at the root of every single thing or every single medical condition that I typically see in my practice. So I could even go as far as saying that obesity is the mother of all chronic conditions, because in some form or format, increased fat tissue or adipose tissue can lead to challenges in being able to effectively manage many of these chronic conditions. If people can essentially help their body by losing weight in a healthy manner and prevent that burden of that fat tissue that's accumulated at all the wrong places, in the long run, their health will improve dramatically.
So, what are the options available now for someone who wants to reach a healthier weight?
Our understanding of obesity has changed dramatically in the past few years. We now understand that obesity is a chronic disease, and we have to manage it just like any other disease. At the foundation of the management of obesity is healthy practices when it comes to our nutritional intake and physical activity. So we want to make sure that the food that we eat is healthy and is appropriate for us and is something that is sustainable in the long run. A lot of times we do understand, just like any other chronic disease, is that these foundational measures may not be adequate on their own because the body needs more help. This can involve various different factors. So we can involve behavioral modification. So things like mindful eating, this is a behavioral modification that we need to incorporate. A lot of times we may be guilty of comfort food eating, like when we are stressed, we then eat, and that's again leading to bad disruption in the wiring of the brain with what our relation with food is. So that needs to change, and that's where behavioral modification comes into place. We now have access to medications developed for the management of obesity in individuals who have not had success despite dietary and physical exercise modification. And these medications have been shown to be extremely safe and helpful in the long run. In fact, studies now show that some of these medications in the long run can help reduce the risk of heart attacks, strokes, death, even heart failure. So all of these can be dramatically reduced by using these medications appropriately for the appropriate person. And last but not the least, bariatric surgery is again another extremely important tool that we now have access to. Bariatric surgery methods as well as outcomes have improved dramatically. And these, again, when used for the appropriate individual, can have very good benefits. So it's important to talk to your healthcare professionals, your doctors, dietitians, kinesiologists, and trying to build what is that healthiest option for you by using a combination of various methods.
So, if someone already has diabetes or high blood pressure or a heart issue, does it still make sense to be focused on trying to reach a healthier weight?
Absolutely. So what we see is just the tip of the iceberg. If you already have one of these medical conditions, it's only a matter of time where if the obesity is unchecked, many of these conditions can then mushroom into even more complications. So what we see, for instance, if we take the example of diabetes, what we see are elevated blood sugars. But if we are not addressing the root of the problem, if we are not addressing the blood sugars as well, then down the line, these high sugars can cause more inflammation in the eyes, in the kidneys, in the nerve endings. And then, unfortunately, some people can develop complications such as loss of vision, kidney failure, or even nerve problems. So it's never too late. And just because you have had a medical condition related to obesity doesn't mean that you should not work towards addressing that root, because otherwise these things can snowball into something that is way more disastrous.
Dr. Jain, thank you so much for joining us tonight. This has been such a wonderful conversation.
Thank you for having me, Ansley.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. Melatonin is a hormone that helps our bodies A, sleep, or B, digest. The answer is A, sleep. If you didn't get to answer the trivia question, but you'd still like those recipes that can be made with a rotisserie chicken, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.